Good morning, everybody. Welcome to the October Business Advisory Council meeting. Today, we are very fortunate to have two people from CBIA here to give us a talk on the discussion of health insurance and workforce policy development. We have Wyatt Bosworth and Zane from CBIA, and they've put together a great presentation to go over some upcoming things that are happening in the business world. So with that, Wyatt, I'm going to hand it over to you, and I look forward to the presentation.
Thank you, Tammy, so much. And I'm going to quickly pivot and give it over to Ashley because she's actually leading us off on this presentation. But thanks for having us both.
Thank you for coming, and good morning, Ashley.
Morning. So just as a quick who we are, CBIA is the state's leading voice for businesses. We represent pretty much every sector, and 95% of our members have fewer than 100 employees. We have Christy Pentimba, who's our president. He just started about a year ago in the pandemic. So we've really been focusing a lot of our effort and energy on insurance and workforce development. So as a lot of you know, they had the workforce strategic plan put out by the GWC, the Governor's Workforce Council, and it really focuses in on 4 specific industries. You've got life sciences, biosciences, the business and IT industry, manufacturing, and allied health. So what they're really doing is focusing on the manufacturing sector and using the Manufacturing Innovation Fund to really tackle some of the problems they're seeing, including investing in capital projects. So the voucher program has gotten some additional funding. So this way you can further develop your equipment and expand as you need. The Incumbent Worker Training Fund allows you to reskill and skill up a lot of your employees. The Manufacturing Apprenticeship Tax program and the apprenticeship program in general, they put in additional dollars to run that program. And then what they're also now doing is, the nice thing about the Office of Workforce Strategies, which is running a lot of these initiatives tied to the strategic plan, is they're focusing on cutting down silos and focusing on education as a pathway for workforce development, both at the K through 12 level and in the post-secondary level. So what one of the programs they're going to do is be offering internships for engineering programs, manufacturing programs at an earlier stage within their post-secondary education. So they want to get these students into businesses, into locations, ideally in their sophomore and junior year versus their senior year, which everybody knows the senior in college is scrambling, trying to find a job. So if we get these students into these programs earlier, hopefully they're more likely to stay in Connecticut and be more invested within our state. Another thing that they're really doing is trying to align the regional sector partners. So there's 5 in the state, and they're the contact information for all of them, but really trying to find best practices with all of them, as well as really trying to have companies utilize the resources available. With the federal government doing the Build Back Better program, they're really relying on partnerships between regional workforce development boards, companies and private business, as well as the state. So this is a huge, huge component for really tackling some of the strategies within the strategic plan. And so just a quick overview of the Office of Workforce Strategies and who they are. Dr. Kelly Valerie, she is the Chief Workforce Officer. She's the first one in the state. And what they really focuses on is that career pathways, the work-based learning, the dual credit programs, and which is really neat, the digital literacy professional development. So you can have great students, but if you don't have great teachers to teach, your student outcomes aren't going to be the same. So really trying to hone in on professional development for this new generation, for these kids in these new jobs.
Now, I'm sorry, can you go back to that for 1 second? I don't know if I'm supposed to ask questions as we go, but is that for all of the school districts, like the dual credit and the digital literacy? Is that any school district can take part of that?
Yep.
Oh, wow, that's
So
great.
they're trying to really make sure that as a state as a whole, we're really developing this. And it was actually built into the implementer bill for the budget in that huge 800-page bill. Some of the dual enrollment and dual credit and alternative pathways. So having kids have an actual career development plan when they're going through middle school into high school, so that when they do graduate, they don't necessarily go to a college that might not be a great fit for them or not go into the workforce or military, but there's a plan in place for them earlier on based off of their skills, their talents, their strengths. So that's going to be really great to see and really hone in on some of these sectors and the trades that people haven't necessarily been given the option to look into in the past. So that's going to be really exciting.
I would agree. I think the last probably, two decades here, the focus has been get every kid into college. And in doing that, we've really kind of robbed our manufacturing and our hands-on work stuff, our trades and that. So I'm really happy to see this.
Yeah, so that was a really big focus because a lot of these industries are within the strategic plan that we do have to focus on.
Good. Thank you.
So the other really great thing about the Office of Workforce Strategies is they are looking at partnerships with other institutions, other businesses. So instead of just looking inward within the state, they're branching out. So many people have just heard about the Amazon partnership to do certificates, especially within coding and cloud computing. So partnering with, the CCSUs, with the community colleges, it's going to be a big deal, and it's really going to start to tackle and chip away at the job deficits we're seeing, especially within business IT. Another thing that they're doing is trying to streamline the workforce pipeline for healthcare workers as well. We're starting to see a huge amount of burnout with allied health, especially with the nurses and the doctors. One of the great things that we did do this past session was allow for license reciprocity for nurses, doctors. If you've been in another state with that license for, I believe, 4 years, and you come to Connecticut, that license will transfer over, assuming, you don't have anything bad on your record, assuming that there's no huge issue and you pay all the fees associated with the license. Another really exciting program or portal that's coming is there's going to be a one-stop shop for online job seekers as well as for employers who are looking for employees. So if you're interested in manufacturing, you can go to this one-stop shop and see what jobs are listed, what credentials you need for those jobs, where you can find the credentialing, whether it's the community colleges or through one of the programs through a place like CCAT, which is the Connecticut Center for Advanced Manufacturing and Technology. So it's going to be a really great option for people who don't know where to go. And that's also been a huge issue in the past, is most of the time people are out there looking, but they just don't know where to start and what questions to ask.
Do you know when that will be available, Ashley?
They're hoping within the next 6 to 9 months.
That'd be great. And especially now when people are really out there trying to find jobs, it's beneficial to have the information, everything you need right in front of you.
Exactly. And then another great component too is they want to also start a list of, if you apply for a job in manufacturing, or if you're interested in something, you can have your name be put into a pool. So when there's openings in classes, you're already right on the waiting list.
That's amazing.
Yes. And with that, I will kick it over to you, Wyatt.
Thanks, Ashley. And thank you, Representative Nuccio, for hosting both of us. We really appreciate your work that you did, last session, especially being a freshman rep and achieving 100% on the CBIA scorecard. It really shows your commitment to Connecticut small businesses, and we applaud you and look forward to working with you in the future. With that being said, Ashley, if you could just hit the next slide. There's been a lot of guidance and movement in the employment community around, how can employers get employees to get vaccinated? Because we here at CBIA We've been cheerleaders for the state's efforts to roll out the vaccine, and we truly believe that a vaccinated workforce is the key to getting our economy back open. And I know in the event description, there were some questions about some recent guidance surrounding an employer's ability through their health insurance plan, specifically a wellness plan, to incentivize vaccination. So I'm just going to spend a couple minutes going over that guidance. And then Representative, I also know you were appointed to the Behavioral Health and Insurance Task Force in the state of Connecticut. And there were some questions about behavioral health as it relates to the Paid Family and Medical Leave Act that was passed a few years ago. So I'll provide a brief description of that program, the timeline of it, and then also looking at some of the statutory language dealing with substance abuse disorders and leave associated with that. So next slide, please. Yeah, so basically just to get us started, very early in the pandemic, the federal government issued guidance through the EEOC, basically giving blanket approval for employers to offer financial incentives for their employees to get vaccinated. There's just two quick distinctions between what laws are triggered based on if the vaccine is administered in-house by the employer or the vaccine is administered outside by a normal, family doc or a healthcare provider in an outside system. But the basic takeaway here is that under the ADA and under the Genetic Information Non-Discrimination Act, there really are no incentive limits for employers that want to, offer financial rewards for their employees getting vaccinated at an outside health provider. And then that's something we've seen a lot of our business members institute, whether it be gift cards or cash payments on top of their weekly salary checks. Employers are pretty much able to do that. So long as they're urging their employees to get vaccinated at a healthcare provider. Next slide, please. Next slide, Ashley. Yeah, so this kind of made news a couple months ago, and I'm sure you're aware of this, Representative Nuccio, having some experience in the insurance community. But Delta Airlines was really the first major employer back in August to take a new carrot and stick approach, to incentivizing employee vaccination. They have tens of thousands of employees. They have a huge self-funded health insurance plan, and they essentially imposed a $200 a month surcharge on employees that would not get vaccinated by the target date they set. And they were really one of the first big U.S. employers to do so. And under this policy, the unvaccinated employees also faced pretty strict indoor masking and weekly COVID-19 tests. And the reason that Delta gave for doing this was because, because they manage their own insurance plan and they're able to look at the claims coming, and they cited an average hospital stay of $50,000 for unvaccinated workers. So to kind of combat that, they unilaterally imposed a $200 a month surcharge on their unvaccinated employees to kind of shift the payment and risk to those who were using the services. But back in August, there were a lot of employers that may have been interested in doing so, but were unsure on the legality of doing so. So that brings us to our next slide, Ashley. Just 2 weeks ago, the Department of Labor, Treasury Department, and Health and Human Services jointly issued a set of guidance documents, also known as FAQs, concerning an employer's ability to provide discounts or surcharges on employee group health insurance, primarily based on COVID-19 vaccination. And the takeaway here is that the federal government, through their guidance, allows employers to impose a surcharge like Delta does on unvaccinated employees, or on the flip side, also allow employers to provide a discount to those employees who get vaccinated. And this is capped annually, up to 30%, considering all of the other incentives that an employer may offer through a group wellness plan. Next slide, please. So really I won't go into depth too much on this, but the FAQs essentially classify the discount or surcharge as an activity-only wellness program. And it confirms that requiring an employee to be vaccinated to receive a benefit of lower premium, or on the flip side again, have their premiums hiked, does require the employee to perform or complete an activity related to a health factor, and thus must satisfy the existing 5 criteria for activity-based wellness arrangement under HIPAA. So I'm just going to run through those 5 elements right now. Ashley, next slide, please. So first, under a wellness plan, if you have medium to large size businesses in your district, this would apply to them. But first, the wellness program must be reasonably designed to promote health or prevent a disease. So the FAQs suggest, if you're going to impose a surcharge or a discount, have the employer help schedule the vaccination appointments, establish a toll-free hotline to answer questions, offer resources on vaccination, just to make sure that the first element, that the surcharge is reasonably designed to promote health or prevent disease, is satisfied. Next slide, please. The second element to this program is that it must provide a reasonable alternative standard to qualify for the discount on health insurance premiums. So you have the example of employees who have sincerely held religious beliefs, or they're medically unable, to receive the vaccine, and they can get that in writing, either from a doctor or someone else. And what the guidance essentially says is the employer can't not offer the discount to the employee if they're medically or religiously unable to get the vaccine, and that policy has to be in effect for the policy to be legal. Next slide, please. The program must also provide notice of the availability of the reasonable alternative standard. This is simple, just posting and making the policy available for employers to see. Next slide, please. And this is an important one. So the incentive award or penalty cannot be more than 30% of the total cost of employee coverage when combined with all other wellness program awards or penalties. So for example, for my employment at CBIA, we have a couple of wellness programs. One of them is, the insurance company will send me an Apple Watch, and if I hook up my Apple Watch to a certain app and track my health metrics and perform healthy activities, I may be subject to a 10% discount in my annual premium. Well, taking all those different wellness programs into account and adding on top of it the discount that the employer wants to offer for premiums, that combined can't be more than 30% of the total cost of employee only coverage. If it goes over that 30% number, the law deems it coercive and thus illegal.
And I'm sorry, if it's a family plan, it still can't be more than 30% of the employee only plan, correct?
Correct.
So the discount, it has to go down to the lowest minimum, which is just the employee.
Correct, just the employee, yes.
And should we save questions to the end for like what stuff we're getting in the chat and that?
Yeah, let's just,
okay, let's do that.
Yeah.
All right.
Yeah. This part's wrapping up soon. And the fifth element is all employees must be offered the opportunity to qualify for the incentive at least once per year. So, when Delta, came out with this policy back in August, they offered it once per plan year, and thus it was satisfied. So, if an employer wants to institute a discount or a surcharge program, just make sure it's offered at least once per year on a rolling basis. Next slide, please. So this is an example of kind of that the federal government gave that an example of a group health plan offering a premium discount. So The example is a group health plan offers a 25% premium discount of the cost of employee-only coverage, to your point, Representative, to all participants who receive vaccination. To help facilitate the patients getting the vax, the plan has a toll-free hotline about COVID-19. They offer assistance with scheduling, and the plan provides the same premium discount to individuals who can get vaccinated or can provide documentation showing it's unreasonably difficult due to a medical condition, a religious objection, et cetera. The plan also provides a notice of the availability of this alternative to all participants, and they can qualify annually. So this is kind of just a bread and butter example, of the program at work. Just some extra tidbits. The discount or surcharge amount must be included in the affordability calculations. This, I'm sorry, it's not the discount, but the surcharge would be included in the affordability calculations under ACA. So keep that in mind. Employers also may not exclude employees from eligibility of coverage under a group health plan solely because of an employee's vaccination status. This is important. You can't not offer insurance to or a group health plan to an employee simply because they're not vaccinated. That is illegal. You cannot do that. But as I just stated, you can incentivize vaccination through a group health plan wellness program. And also important, through the CARES Act, it stipulated that employers must provide 100% coverage of all vaccination costs, whether that be the first vaccination, the second, or all subsequent boosters. Next slide. So that kind of wraps up that policy, Representative. I don't know if you had any questions on that guidance before we get into PFMLA.
I'm pretty good with it, but there is a question in the chat. Do we want to do that now, or do we want to wait till the end for all of it?
Yeah, let's wait till the end.
Okay.
Okay.
Yeah. I'm
Great.
good.
So, another really big state program that was passed before you came to the legislature, Representative, was the Connecticut Paid Leave Act. And I'm just going to spend a little time, giving a background of the program, where it's at, who's managing it, what the benefits are like. And then they'll also kind of tie the discussion into what are the ramifications for those with behavioral health issues, because I think that's important to your work on the task force that you were selected to. So next slide, Ashley, please. So like I said, paid family medical leave was proposed and passed in 2019. It provides partial wage replacement benefits to employees taking leave under the existing state's Family Medical Leave Act or Family Violence Leave Law. In 2022, the program will be fully up. It'll provide up to 12 weeks of paid leave benefits over a 12-month period. Plus an additional 2 weeks for those with serious health conditions related to incapacitation during pregnancy. And the main quasi-public authority or agency that's going to be administering this program is the Connecticut Paid Leave Authority. Next slide. So the first question, who's covered under the PFMLA? All private sector employees, except those in private elementary or secondary school, some public sector employees, depending on collective bargaining and union, and then also sole proprietors, and those are self-employed, but they must be enrolled for at least 3 years in the program to get benefits. How's it funded? Payroll tax. So all employees who are covered by the program must contribute to it through a payroll deduction starting January of this year. So we're 10 months into the authority collecting funding. And the annual contribution rate is set by the authority, but it's capped at 0.5%, which is the percent that is currently in effect. So all employees in the state, every paycheck they get 0.5% comes out and goes directly to the paid leave authority. Next slide, please. And just some dates. So the registration with the paid leave authority started back in November of 2020. As I said, on January 1, that's when employers began withholding employee contributions to 0.5%. March 31st, this was the deadline for employers to begin quarterly submissions of employee contributions to the program. So they, all employers in the state have to remit the funds to the authority on a quarterly basis. That started on March 31st. And on January 1, that's when eligible employees begin collecting the benefits when they take leave. And actually, they can begin applying for those benefits starting December 1st of this year. So those are December 1st and January 1st are two important dates for employers to be aware of. So who's eligible? Well, covered employees are eligible if they've earned at least $2,325 in the highest quarter for the first 4 of 5 most recently completed quarters. This is a very low standard compared to other states. We have a very generous benefit eligibility package in the state of Connecticut, something we raised a lot of alarms about in 2 sessions ago, but so have you. The employees must also be currently employed, have been employed within the last 12 weeks, or be participating in a self-employed or sole proprietorship. So these are the eligible leaves under paid family medical leave. So parental bonding, this includes the birth of the employee's child, the placement of a child with the employee for adoption or foster care, donors, those who serve as organ or bone marrow donors, those in the armed forces undergoing treatment for a condition that was incurred while serving in the line of duty, or being deployed to a foreign country. Also under family violence, those who have to attend a domestic violence, civil or criminal proceeding can get paid family medical leave. Those who have to relocate because of family violence, those who seek medical care or mental health counseling. And then, the serious health conditions is kind of the catch-all here. For the serious health condition of the employee or the employee's family member, the statute loosely defines serious health condition as something that incapacitates the employee for a period of 3 days or more. So next slide, please. So the weekly benefit, what can your employees get if they submit a claim to the authority? Well, 95% of the weekly earnings, this is a long math equation, up to 40 times the state's minimum wage plus 60% of the amount of the employee's average weekly earnings that exceeds the minimum wage. Really, you can think of it, the ceiling here is the total benefits cannot exceed 60 times the minimum wage, a little over $1,000 a week. And if the contribution rate, and this is important language that was put in the bill, if the contribution rate is at its maximum of 0.5%, which it is now, but it's not generating enough revenue to pay off the benefits, the statute mandates that the authority reduce the benefits to improve solvency of the program. So substance abuse and behavioral health. Right off the bat, an employee with substance abuse is eligible for paid family medical leave if it meets that serious health condition criteria. And it may be taken for treatment for a substance abuse condition by a healthcare provider or provider of healthcare services. And importantly, absence because of the employee's use of the substance rather than for inpatient or outpatient treatment does not qualify for FMLA. So this is important for employers. Treatment for substance abuse does not prevent an employer from taking employment action against the employee. So what does that mean? The employer may not take action against the employee because they exercised their right to take FMLA for treatment. That's true across whatever condition you get approved for. The employer cannot take negative action against the employee simply for exercising the right to take paid leave. But if the employer has an established policy, a non-discriminatory policy, outlawing drug use inside the workplace and outside of the workplace, the employee can still be terminated whether or not they take FMLA.
If they are, do they still collect FMLA?
Yes. Yes.
Okay.
And this is kind of the last thing that I think is important to understand, because, we know that substance abuse, obviously there's, 30, 60, 90 year-long rehab facilities that people go off to get treated. But a lot of people use outpatient services as well. And, under the law, intermittent leave is available to those, not only with substance use disorders, but with any other debilitating disorder. Leave can be taken intermittently or on a reduced leave schedule when medically necessary for the treatment of a serious health condition. And this can include leaves of periods from an hour to several weeks. So I think the takeaway here is that whether it be for substance abuse, for any other issue under the law, an employee can go to, services for 3 hours out of the day and work the other 5 hours. A lot of people with substance abuse issues, specifically those on opioids, may, to have it declared medically necessary to go to a methadone clinic in the morning, for example, or they have to pick up their pills every day. And things like that are covered under the FMLA Act, the paid FMLA Act, to allow for that intermittent leave or a reduced leave schedule. So just some high level takeaways from both the federal guidance on some new vaccine incentives that are permissible under federal law, and then also a background on the FMLA Act and some specific language as it deals with behavioral health and intermittent leave. So that kind of wraps up my section. I'd be happy to take any questions if there are any.
Okay, so we do have a question in the chat, going back to the insurance portion. Referring to the surcharge, is there concern that this could open the doors to allow employers to charge discounts for employees with HIV or CA as their costs are higher than normal? Can they raise rates if they don't join a health club if they're obese, or as those patients will cost them more, or if they smoke, et cetera? Isn't this contra to the Obamacare program?
Yeah, so we're really dealing here when we're talking about the surcharges. We're not really talking about really small businesses that are in small group fully insured plans. We're talking about large employers and self-funded plans that have wellness plans instituted that, for example, it's perfectly legal under federal law if someone's a smoker and they report as a smoker.
Yeah.
A lot of employees will add a surcharge onto their premium, with the idea being that we know that smoking leads to complicated health issues because of the tobacco use, and that's used as a way to incentivize people not to smoke. The same holds true with COVID as well. I'm unsure about, we know that because someone has a medical condition, you can't not offer them coverage because of that. And also the wellness program, the program has to be reasonably related to a certain healthcare outcome. So, having HIV is not a healthcare outcome. What we're talking about healthcare outcome is getting vaccinated, and that has to be reasonably related to a goal, and that is to improve vaccination and health in the workforce. So,
and I do think technically, if you have a high BMI, there are some insurance companies that can charge you more for that. Like if you have an excessive BMI and you're not on a weight reduction program, that's also a wellness-driven upcharge. Sometimes it's not
correct.
common,
Yeah,
but there is the ability to do that.
Yeah, and more often than not, it's not the insurance company really offering that as a mandate to the employer. It's something the employer,
Correct.
they negotiate with their broker and with their wellness provider. It's important, the takeaway here isn't that insurance companies are going to start requiring COVID vaccination. That's not what they've done. This is simply a way for employers that look at the cost benefit of imposing the surcharge, looking at the profile of their workforce, and telling their insurance company or their wellness provider to institute this program. This is something that is voluntary and that employers are doing on their own initiative.
So you bring up a really good point there. A lot of the plans that we've been trying to kind of move some of the small business toward is the business exchange. And on the exchange, those plans are fully insured. And those are pretty standard plans that are found within industry. But as you mentioned, the majority of the people who have these types of wellness things are what we call ASO or administrative services contracts. And in those cases, the employee themselves, the company themselves are providing the insurance. They're also paying 100% of all the claims. So their wellness plans are pretty tailored to what they want to offer and to what they want to incent from behavior in their employees. Mm-hmm. So the fact that they're charging a surcharge, whether it be for smoking or BMI, there are also incentives if you have high BMI to lower that, or if you have high blood pressure to work with somebody to bring that down. These plans in total are derived from the employer, from the company on impacting the wellness of their employees. So that gets me to, I think I know the answer to this question, but I'm sure everybody else doesn't. So with the vaccination thing, this is mainly driven at the employee also. So if I'm a family of me, my husband, and 2 kids, and my children aren't vaccinated or are vaccinated and I'm not, the vaccination upcharge is based off of the employee and not all of their family, correct?
Correct.
Because you cannot have a wellness plan that necessarily negatively affects your family because they're add-ons. So that's an important thing to look at too, is they're looking at the employee in relation to their employer wellness plan.
And Representative, also another thing, a lot of these big employers, you mentioned that when you're a big self-funded plan, it's the employer who's liable for paying those claims out, all 100%. It also in large group, fully funded plans, if the group is big enough, those employees, that employer profile also receives an experience rating as well, affecting the premium. So, these wellness programs, if you're in a medium to large size business, even some small group plans have wellness programs. Chances are you've been sent a letter in the mail about a BMI program or an Apple Watch program. This would simply be another program that if it's a discount you can opt into. If it's a surcharge, you can opt out of at your own will. So
I think the other thing to note here too is that a lot of people don't realize is that the majority, and I mean extremely high majority of people in the state of Connecticut that have insurance plans are under administrative services plans. It's only a few 100,000 people that are affected by the fully insured portion. So a lot of this is employer driven. One of the other questions that's on here that I think maybe we can kind of give a little bit of time to is, does this open the door for employers to mandate other vaccines or medical treatments? And from my perspective on that, I don't know, I'm trying to think back, for instance, in a lot of ASO plans, in order to get your health benefits, they mandate you have a physical. But, and there are some companies that do mandate certain vaccines. My daughter's a nurse. In order to be a nurse, she has to have her Hep B, her Hep C, her flu, her, she is mandated. So I think I don't know that this necessarily opens the door for mandates. I think all the mandates are pretty specific to the employer role, but maybe you can kind of give us a little bit on that.
Yeah, I'm going to be honest. I'm not entirely sure. The only thing I'd say is it's important kind of distinguish a mandate from a wellness incentive. All right.
Right.
So, what I just talked about was not necessarily a mandate. You're not going to be fired or put on leave for not getting a vaccine. But the carrot, would be, a premium discount, the stick being a premium surcharge.
Right.
You'd still be employed. The mandate, on the other hand, you're talking about actually requiring employees to complete a certain condition for employment, that's getting vaccinated. And that's something we're seeing coming out of the White House probably next week with the OSHA mandate for 100 or more employees, employers with 100 or more employees. But to be honest, I don't know enough to give a legal opinion on other vaccinations. I do know that we know that employers are legally allowed federally to mandate vaccines. There's been thousands of private vaccine mandates across the country as it deals with COVID. My knee-jerk reaction would be to, the logical nexus of that would be that they could also require other vaccines as well, but not 100% confident.
So you just mentioned something that maybe we could get some statistics on. For instance, in the beginning, you guys said that 95% of the companies that you represent have under 100 employees. And I know that I believe, correct me if I'm wrong, but I believe the majority of people who are employed in the state of Connecticut are employed by small businesses. So how many businesses do you represent that are under 100 employees that this would not apply to, but still have the option? It's not that they don't have to do it, it's that they have the option for what's going to roll out from the White House.
So I'm constantly told by our communications and legal people not to disclose exactly how many members we have.
Okay.
All right. But we are gaining more and more members every week. But I can tell you, over 5,000 employers that we cover would not be subject to the mandate in the state. We primarily represent small businesses, the local delis, the tire shops, the insurance brokerage houses. That's the bread and butter of our membership. We also represent the biggest employers in the state as well. The Pratt and Whitneys, the Aetnas, the Anthems, the Sikorskys. So, of course, those employers would be subject to the mandate, but
they are.
But as far as CBIA business members, the vast majority of them are not subject to the mandate. But we know from our survey data, while the majority of our businesses are still hesitant on mandating a vaccine, those that are interested in providing some type of incentives and or mandate, that's kind of growing. That's what our survey data shows us. So, this data today is just another tool that, businesses that, are able to negotiate with their carriers, whether they be in a small group fully insured plan or a large group self-funded plan, another tool in their toolbox if they want to incentivize vaccination.
Yeah, I think it's also important to know like you said, the over 5,000 small business is really the bread and butter of the Connecticut industry across the board. So you mentioned a lot of things here when we talked about the PFMLA. Looking at that, has there been a lot of talk in the small business world around how they're going to manage the time off and what's that going to mean to them from the perspective of workforce and being able to plan for? I know we have a severe shortage right now. We have a lot of open positions in the state. So navigating having open positions and also the FMLA up to 12 weeks, even with the sporadic of a couple hours here and there, is there any concern in the industry on what they're going to be able to do to be able to mitigate that non-productive time on the floors?
Yeah, this was a top 3 concern of ours with the bill back in 2019, and And with COVID and a lot of the workforce shortages that Ashley just talked about, those concerns are multiplied by 1,000 because there's a huge problem right now in the state of Connecticut with open jobs, with employees still out on unemployment, and the inability for employers to fill those positions. We don't know how many people are going to apply for benefits and get them approved December 1 and start receiving benefits January 1. But it's a concern that is definitely being relayed to us from our small business members. Especially because if a person takes leave for 12 weeks or 14 weeks, if it's a pregnancy issue, they're entitled to that job when they come back. They're entitled to the same responsibilities. And especially with those that take it intermittent leave, that creates problems throughout the day. Someone coming in at 12 o'clock, 5 days a week, who's going to cover that morning shift for them? That's certainly going to be a problem in the service sector. But it's definitely a concern, but we really have to wait and see how popular the program is and how many people actually apply for benefits before we can really assess the true effect of it.
Yeah. So I don't know. I have another question on here from Diane. A year and a half ago, CBIA webinars were saying the COVID vaccine would never be mandated except in the health field where flu vaccines were already mandated. And now they are. My small businesses are worried that the over 100 employees will change like many other programs. I think unfortunately with that, CBIA doesn't control that. That's coming right from the White House. So I don't know how to assuage that.
Yeah, I can tell you, I understand the frustration of the person who asked the question, but we don't do federal lobbying. We're really a presence in the state legislature. And I can tell you, our CEO in meeting with the governor, we've been pretty steadfast in telling the state not to mandate something for the entire business community to abide by, because every employer is different, every employee profile is different, and vaccine hesitancy may be more prominent in certain fields than others. So kind of a cookie cutter approach to mandates, at least on the state level, was something we communicated to the administration, and we were effective, but the federal government came in, 2 months ago due to lagging rates, and decided to vaccinate for over 100 employees. But that doesn't affect 95% of our business profile, of our membership profile. So it's something that our big companies are going to have to deal with. It's important too under the mandate. It should really be called a testing mandate with a vaccine opt-out, because people won't lose their jobs for not getting vaccinated. They'll just be subject to weekly testing and masking requirements and other requirements. So we'll see how it plays out. But I think the unfortunate thing is we still haven't gotten language from the federal government on what the mandate's actually going to look like. Like I said,
as well as I know,
yeah,
in the language is what matters. It's never the title of the bill, it's what's in the bill.
Yeah, and a lot of concerns that our big employers have is who's going to be responsible for paying for the testing? Who's going to be responsible for paying for these requirements for employees who decide not to get vaccinated? That's an issue that a lot of large employers have, is the cost question. Which is why, we're putting out as much information as we can for those employers who are concerned about that, who maybe, in addition to the federal mandate, can offer other incentives to try and get their employees vaccinated. The health insurance discount wellness program is just one of those.
Well, and you bring up a very important point, because this gets back to one of my probably one of my biggest pet peeves. Free testing isn't free, and it is being paid for. I think the average cost of a COVID test is around $200. And that $200 doesn't, this isn't like the benevolence of the federal government's heart that this is being tested and nobody's being paid for it. It's being paid for by the employer. If you're on an ASO plan, we do not have the ability to charge the employee for it right now. So I can understand some of the fears where if you decide to not get vaccinated and you have to do the testing, eventually that testing cost, right now, the federal government has mandated that it is free to the employee, which means the employer is paying for it, which will again increase the cost of healthcare because it has to be paid for by somebody. But eventually that might trickle down also on top of the premium search upcharge or the other things like that. And I have heard people voice that concern, like, is this going to fall back on me to have to pay for this weekly testing? So I think that's still up in the air. Again, I haven't seen the language yet from the White House either. But that could be part of I don't know that would be part of an insurance benefit plan buildup if that was the case. Because I don't think right now COVID has been spiked out on any benefits summaries or anything like that. It's just assumed 100%. It's like preventive care, right?
Yeah. And I think we saw that in the rate filing process at the Department of Insurance. Yeah, on the hook, and we'll see the final language, but if the employer is on the hook for testing, I think, what I talked about with the discount help the employer defray some of those costs. If an employee doesn't want to get vaccinated and the employer's on the hook for that testing, I think you're going to see more employers, finagle their wellness programs to try and shift that cost sharing back to the unvaccinated employee. But the devil's in the details. So as soon as that federal rule comes out, we have in-house HR and labor attorneys that will draft up guidance, and we consult with other law firms across the state to provide employment law briefs for our members, and we'll certainly be on top of that from day one. And if anyone on this call has any, I know we're reaching 8 o'clock, but I just wanted to say, if anyone on this call, whether it be those who work for the local chamber in Representative Nuccio's district or a business member, please reach out to either me or Ashley on any issues that we cover.
Okay, I have one other question on PFMLA, and then Ashley, I do have a question for you on the portion that you have, if you guys just have a couple more minutes, because I think it's important to the healthcare field and the license say the word, please, because it's morning. What do you know what I mean?
Reciprocity.
Reciprocity, there it is. Okay, so the PFMLA question was, if someone goes out on FMLA in December for a baby, and it's their 12 weeks, do they get 4 weeks unpaid and then starting in January, 8 weeks paid, or can they apply for the full 12 weeks post having the baby? I don't think they can. I think the FMLA goes from the date of incident, if I recall, correct? So if you give birth on December 1st, you can apply for January 1st, but those first 4 weeks would be unpaid, and then you would get 8 weeks because it's from the date of incident, or is it from the date of application?
I don't even think that's relevant, Representative, because the benefits won't be paid out until January 1st. So if someone has a baby on December 1st, they would apply to the state for benefits beginning on January 1st. That's when the benefits begin.
Okay, so they can get 12 weeks from January 1st.
12, yes, correct.
So they would have the first 4 would be unpaid, and then they would get 12 weeks starting January. So technically they would end up getting 16 weeks off, but only 12 of them paid.
Correct.
Okay, that makes sense. Now, Ashley, in regards to the licenses, I think this is really important to note, because the law that was passed said as long as you're licensed 4 years in another state, you could come to Connecticut and your license would be recognized. And we have an extreme shortage of healthcare, right? Of healthcare resources right now, going from nurses all the way down to PCAs in the home health field. I'm getting emails all the time about the PCA shortage and home health care. And I know for a fact the nurses are ridiculously burnt out, and some of them are even refusing to pick up shifts, and to the point that I think it's actually dangerous when you've got 2 nurses on a floor with a 30-bed unit. It's well beyond any kind of standard of care that we should be even allowing. So at this case, what can we do to try to start to advertise this reciprocity? I said it, look at that, reciprocity, and try to get some more people to come to the state of Connecticut to be employees in our healthcare field, because we're definitely lacking.
Yeah, I think starting a marketing campaign, you know, a lot of the times we don't love the idea of the state spending money on things like marketing, but the fact that there is such a burnout for nurses and we really do need people to come in, just demonstrating all of the new and wonderful things that Connecticut has to offer. So if you're living in New York and because of COVID or whatever it may be, we're starting to see a lot of migration into the state. So we need to keep marketing that, keep that front and center. We need to start also working through the university systems as well. So I think a lot of people saw University of Maine for a while was offering the same tuition price as UConn.
Yep.
So maybe looking into innovative ideas like that, saying, hey, we'll offer you the same tuition price if you go as University of Massachusetts or University of New York. So using those kind of ideas to get people into our state so that we can fill those burnout positions, especially in nursing.
That's actually a really good idea, the tuition matching from other states. I think this is definitely an area that we're going to need to focus in on, the healthcare field, especially like you mentioned my mental health task force, Wyatt, you know, that's really trying to focus on how we get more providers and network, increase accessibility and affordability. And one of the things that I've heard from people that I've talked to already is just the lack of providers that we have. It's almost like a provider desert when it comes to mental health. And when we have to start doing telehealth with providers that are 4 states away because we can't provide them services in our state here, then I think we need to try to find a way to incent these new grads and these new doctoral candidates, these people to come to our state. And I think that's where we really struggle. But continuing to work with CBIA and the legislature and to try to find innovative ways to bring these resources to the state really has to be a focus, not just from the perspective of it's nice to finally have, you know, 5 people move to the state rather than 20,000 people leave the state. Besides that portion of it, it really is helpful for us to kind of build our professional workforce and be able to provide accessibility and affordability to people. So I appreciate that the portion that we went over there for all of that, and I really appreciate the wait list for jobs and classes. I think that's a phenomenal step forward. And
yeah, we don't want these just to be unfilled classes. Like you want a full class. So this is a great way to get people re-engaged if they didn't get into the first round. And a lot of the times if these students don't get in the first time, they forget about it and move on to the next. So this is a great way to re-engage.
So in the last couple of minutes, I want to mention there's one other thing on the governor's workforce committee. I'm involved on that. I'm on the committee, and I'm handling. I've been pretty involved with the benefit cliff, but there's also in that benefit cliff, there's a tool that they've been bringing up that I think is definitely worthwhile that we should start to employ at schools, especially high schools and colleges and stuff like that. But there's a tool that they had, which it's mirroring the benefits that people are receiving and then jobs that they want to do. And they're putting this information all into this one tool, which kicks out, well, if you are a single mom and you're receiving these benefits, et cetera, it's going to take you this long to get your CNA. And when you get that, this is the average salary that you can expect and how many years it would take you to be independent and off of any of the state's services. But I thought if we added into that tool just the information on colleges and stuff like that, we could really start to drive people to college degrees or to programs or certificate programs that would truly enforce income independence and be able to kind of have a glide path for the most needed positions that we need in the state and show how it'll cost you this much to get this degree. And these are the services you can get while you're doing that. In the end, this is what you can expect. to really try to grow a workforce. So I'd like to see some kind of marrying up of the workforce development and that tool.
Yeah, that would be great. You know, I think a lot of the times people also think that getting that degree or that certificate will put them in debt for the rest of their life.
Yeah.
And they don't know that they're eligible for other services, or that realistically they'll be out from under it within a year, 2 years. But a lot of the times it's just what people have for these preconceived notions of what it means to just get the degree.
Yeah, there's definitely an education opportunity there. But it is now 10 after, and I have kept you 10 minutes past the time that you committed to me. And I know that you are probably even more busy than I am. So I want to thank both of you for coming and doing this presentation today. I appreciate it. I'm glad we've recorded it and it's on Facebook. Anybody who signed up that wasn't able to come can go back and view it. I appreciate your time and the information that you've provided. And I just want to thank you for coming out and having tea with me in the morning.
Thanks for having us.
Thanks for having us.
Have a great weekend.
You too. Bye.
Bye.